I'm Dr. Danny Rabwin. I'm the founder of Ready Vet Go, which is a remote mentorship program for new and early career veterinarians. And we are here to support the veterinary profession at large. And that includes a lot of veterinary technicians, veterinary students, people in the animal health community. As part of the Ready Vet Go program, we have monthly drop-in Ask a Mentor Anything, and that's what tonight is. And these are super casual. Some people might come in later, people drop in and out. Sometimes we have people come in with medical questions, and we always invite a different Ready Vet Go mentor to host. And so tonight, the mentor that we have available for questions is Dr. Dwight Alleyne, and he is a veterinarian who graduated from Cornell and then did a rotating internship at Purdue. He's been in many different clinics over the years. He's currently in practice in Georgia. I just learned he's at the end of his MPH program because he wanted to get another degree. We're going to hear why. He has a lot of experience. He's a mentor for our current Ready Vet Go cohort, and just has a ton of stuff to offer. And so he's available to you for questions. So I'm going to pause, and Dr. Dwight, I'll just let you say hi. And then Amaya, if you feel comfortable introducing yourself, since you're here, we would love to know a little bit about you as well.
Sure.
Hello, Amaya. How you doing today?
I'm doing good. How are you?
I'm doing well, doing well. Glad you could join us today.
Absolutely.
So how did you come to join us?
So I just graduated from Lincoln Memorial University.
Congrats.
Thank you. And I got a job here in Beverly Hills, Florida.
Amazing.
I didn't realize there was a Beverly Hills, but apparently there is. But I got a job at a mixed animal practice, and he had a previous doctor that did the Ready Vet Go, and she said that she absolutely loved it, and he and her are both like all for it, and so they're now having all the rest of the doctors do it. So he's paying for this mentorship for me since I'm a new grad starting there.
Amazing. So you work for Dr. Dunn?
Yes, I do.
Oh, he's just so wonderful.
Okay, you know who I was talking about.
I do, yes. So one of our earlier mentees came from Countryside. So so Amaya, just so you know, this is not part of the formal Ready Vet Go mentorship program. This is kind of an extra. So you are not required to be here. You are invited to be here. We love that you're here. You just graduated, which means you might have quite a few questions. You are going to be put in a pack with other mentees when the program starts next month. But this is extra. And so this is an opportunity. Dr. Dwight is not going to be a mentor in your cohort.
Gotcha.
And so this is an opportunity for you to ask him any questions that you have. So that could be about medicine. It could be about starting your first job. Anything, really. I mean, anything is on the table. If you came tonight with questions that you have, I will let you run with those. I also have questions that have been submitted by other new grads that weren't able to make it tonight. I do want to welcome whoever just popped in on iPhone. I don't see your name or your face, but we're glad you're here. If you want to, if you don't feel comfortable coming on video and you just want to drop into the chat, whoever's joining us on iPhone, where you're joining us from and what your role is in the veterinary profession. If you're a new grad, if you're a vet student or somebody else in the profession, maybe we don't have that person anymore. So Amaya, I will just ask if you already have questions that you want to jump off with.
I guess just generally the mentorship program, the Ready Vet Go, like what does it look like going forward? Because I know that Dr. Dunn firmly believes in it, and he's super excited to have all the doctors do it, but I'm not quite sure what's all involved in it.
Right. Yeah.
To be honest.
No, it's a lot of people don't. So your kickoff meeting, you have a kickoff meeting with your entire cohort. You're going to be with about 25 other new grads. And your kickoff meeting is on July 19th. You should hopefully have an invitation to that. and we are going to walk you through everything. You also are going to be getting an invitation on July 1st for you to sign up for the online portion of the program. And that will give you a welcome email or a welcome video where you can learn all about the program in a nutshell. And I'll tell you my perspective from it as the founder. And then maybe Dwight, you can just share your perspective as a Ready Vet Go mentor.
Yeah.
What Amaya can look forward to. And Amaya, you just got your DVM, and I'm so sorry I'm calling you by your first name. How would you like me to refer to you?
Oh, honestly, first name's fine, but my last name is Beers.
Beers,
So
Dr. Beers.
Yeah,
You earned the Dr. Beers, and I just went right to your first name, and you have been a proud doctor probably for a couple weeks. So the program is really designed to support you, providing you with support in addition to what Dr. Dunn and the Countryside team are going to be providing to you, picking up some of the areas that really aren't covered very extensively in veterinary school. So things like navigating difficult client communication challenges, being a leader in your practice, managing your time, basically taking all of the things you learned in vet school and translating them into practice. There's so much content. You're going to have an online portion that you can progress through on your own time. There are modules that ask you to complete prior to each month's meeting. There are 75-minute meetings every month. We call those Vet Success Workshops. And those workshops focus on the month's topic that you're going to be learning on the online portion. In every Vet Success Workshop, you're going to have an opportunity to hear from a speaker speaking about that month's topic, and then go into breakout rooms with a mentor to just dive deeper into those topics. You're also always going to have an opportunity to go into a medical case rounds room in case you have a medical case that you want to talk about. Gotcha. Your entire cohort will be going to those meetings. In addition to those meetings, you're going to be put into a pack, and packs are really where things shine. They're kind of like what this will be tonight. They're very intimate meetings. Pack is going to be 2 to 3 other mentees and a Ready Vet Go mentor, and you'll meet twice a month in the evenings. And those are really an opportunity to just talk about any challenges that you have. They're a very safe space. You can talk about any challenges that you're having in your clinic. We don't go, obviously I'm fond of Dr. Dunn, but my loyalties are to you. We do not go back and share anything with him unless you want us to. It is a really safe space just for you. And for you to start forming community, networking with your peers, and really getting a solid foundation to help you love this profession. All of us mentors love veterinary medicine. We're excited to have you here, and we want to make sure that you get started off on the right foot with people who are very positive about the veterinary profession. So Dwight, what do you have to add as your Dr. Dwight's about halfway through his first cohort as a Ready Vet Go mentor. So I'll be curious to know from your perspective what you would say to an incoming mentee who's going to be starting with us next month.
So I view the pack meetings as a time where you get to see people who are in a similar position. Some people are a new grad, very new, or some people are kind of like 2 to 3 years in. It kind of depends. It can vary, but you get to see people similar and from different backgrounds as well. And what you kind of comes to comes to fruition is that they're all experiencing similar anxieties or challenges that you are, and what a lot of the mentees appreciate is that they kind of have that, they come to realization that, oh, we do all have the same issues or challenges, or and that makes them say, hey, I know somebody that's going through the same thing I go through, so it makes it easier to go through the process. So that's what a lot of the mentees at least kind of recognize and see, and allows them to kind of discuss, a lot of things where they might not be able to feel comfortable or have anybody to discuss with or anybody to relate with. So it gives an opportunity to relate to people who are similar, and then even recognizing that people who are, experiences me still have similar challenges. So, but we can, and the difference is that we can help each other because we can share and learn from our experiences, and we kind of pass on that information. Hey, this is how you deal with it. We can give advice and we all learn from each other too. So that's where people benefit the most in the pack meetings. It's you'll see that people that like, oh yeah, I went through this, I heard this story, and like, wow, I'm glad I heard it because I was thinking I was all alone, the only person going through this. And so that's why it comes, that's why my perspective from the pack meetings is definitely, I call it therapeutic.
Yeah.
Because we are going to go through challenges. Is this you just graduated in
In May.
just in
Yeah.
May? Okay.
Like, yep.
So so yeah, when you graduate in May, you'll kind of go through the cycle where you're kind of like a little nervous, kind of go through new things, and you kind of go through. I call it the roller coaster.
Yeah.
When you go through the experiences, because and then it helps to say, hey, we've been through this. It'll be okay, even though it seems frightening or a little anxiety causing it initially. So, but you'll see that, hey, he made it through. I can make it through no matter how
Yeah.
insurmountable it seems. So basically, so the pack meetings are definitely a great benefit. I think that a lot of people do benefit after going through it for the 6 months. So
Gotcha. Awesome.
okay.
How's the transition been? Have there been any challenges that you are facing that you want to sort of brainstorm with us while you have us here?
Well, I haven't seen any rooms just yet. They have me training for about a month, just kind of
Great.
shadowing and getting familiar with the system, the way they do things, their drugs, all that. But I can tell already that I may, when I go into a room, I might have a moment of like where just all information will just empty my head, and I guess I'm trying to figure out a way to kind of calm myself down and go through what I know in front of the client without letting them know that I'm doing that, if that makes sense.
Yeah, it does make sense. And I used to a couple of tricks that I recommend to is one is you don't have to know everything, because you can tell a client, and hey, this looks similar to this. So I'm not as familiar, but based on what I understand, what I'm seeing, this is what I suspect that this could be, or even say, oh, I'm just trying to get some more information. But a trick I used to do is I used to be very tech savvy back when I graduated about 18 years ago. I used to have like the small animal nerd book, which was kind of popular. I still do have the 5-minute consult and the plums. I used to have on devices, portable devices.
Right.
So basically, where I would go in and the technician would come out and say, blah blah blah, or whatever, these blood work changes and stuff like that. And I would just go look on it, really look at the 5-minute consult. Was very quick. I'd go through and look at the 5-minute consult, and then I would go in and look like I'm smart in front of the owner, and I just read the 5-minute consult, something
Yeah.
like that. And even if I have to go out the room, I might say, I do a little small talk and say, hey, I think this might be what it is, and I'll go out and look up, based on the clinical signs. So this dog has, epistaxis unilateral, and I'll look it up on the phone, and I'll go and I'll read it real quick, because it only take me a little over 5 minutes to read, and then go back in the
Yeah.
room and regurgitate it to the owner. And
Got
then the owner, and that worked for a while, because at the same time when I kept doing that, I kept learning more about similar cases.
it.
And so that worked for me, but it helped that I had that on a portable device versus trying to flip through a book,
Mhm.
or something like that. So that's what I did when I was my first couple of years. So
Gotcha. So you like try to find a way to leave the room for just a second and then pop back in.
yeah, because I might just say, oh, I found this on this exam. This is why maybe, and then I may leave the room, and or sometimes if I have good technicians, they may give me enough information based on what they see, based on if they do the
Right.
history, and then I'll look that up based on that. if I got blood work results back, I'll look up stuff like that too. I'll say, oh, this is hypocalcemia. I can look it up real quick and
Mhm.
to go from there as well. So
Gotcha.
that'll be one trick I would do. So
Okay. Um, I guess another question would be if you go into a room and then the patient is a little, I guess, feisty, how do you go about, asking them to put a muzzle on or like even going as far as, hey, why don't we do this in the other room or, sedation, that kind of thing? How do you go about talking about that?
so it kind of depends on the why they're aggressive.
Hmm.
And obviously it depends on the creature, whatever the creature is. If
Right.
you're in a mixed animal practice, so obviously if you're dealing with a horse or a goat or I don't know what animals you can be dealing with, but I know
Hmm.
my specialty is cats and dogs, so it kind of depends on why the animal's aggressive. But
Hmm.
sometimes if the animal's just aggressive by triggers, or versus they want to kill you regardless. It doesn't
Yeah.
matter. It kind of approaches it differently. I know I work at a fair free practice, so
Hmm.
we do utilize like chill protocols if
Right.
the, the patient's too aggressive. But sometimes we kind of do gentle um like using treats or different techniques to calm them down. Sometimes the pet owner does better away pet does better away from from the owner, I mean. So sometimes
Hmm.
we do those tricks, but if the animal's aggressive, I always make sure I don't use language that's like too negative. I'll say, yeah, he's just not too happy with this at this moment.
I
So
see.
so we might just have to put this just to keep him calm, just so he won't, get too stressed or anything like that. Um, and then usually I also emphasize that, hey, we just don't want him to be too stressed. Because I really say, oh, he's aggressive, he's trying to kill me. I would say, yeah, he just seems too stressed. We may have to have him come back, which is it'd be better for him, so you won't have that
Mhm.
long memory of a bad experience here. Um, but also too, when I do mention, it just depends on how far I have to go for sedation. If I have to do
Mhm.
sedation, I most times when I approach it, most clients are okay about it to say, hey, we tried the pill protocol, but he may need a sedation. Is this something that we can reverse? And he may pop back up, but it'll just be better for him so he's much calmer and it'll be
I,
less stress for you and less stress for him or her or whatever the creature is, dog,
yeah.
cat. So. But we do fair free techniques with the cats that we use blankets with pheromones on it. The dogs will
Mhm.
do lick mats, will do where they lick treats and stuff like that. So a lot of dogs I'm able to handle um, most of the time. And then
Mhm.
sometimes I won't force a physical exam. Sometimes I have the dog facing away from me and the owner's petting it and distracting it. And I'm able to
Right.
do based on what triggers it. But some dogs don't like to be approached from the front. So I approach them from behind. I can do that. Um, Most owners understand if a dog needs a muzzle. I don't have an easy issue with that in most cases.
Gotcha.
So,
Okay.
but any
To the
other
question. Um, I'm going to ask a question from somebody who wasn't able to be here, but wanted their question answered so they could review it later. So the question from this person is, this is a new grad, and they ask, can you provide any advice on how to make the most of an internship experience to maximize learning and networking opportunities?
So to maximize the most of an internship is, I think the number one thing is deciding where to go. So I don't know if that person who asked the question has already picked the internship, they're already there. Because if you're not there, then it's usually you have to carefully look at what the internship offers, look at the doctors that are there, especially if there's you have a specific interest in surgery or orthopedics or whatever the specialty is, that you have the doctor that would, that about that specific person to maximize that. I find that the best internships, even though you do have an interest in a specific field, that you get to rotate through all the rotations because you never know if you're going to have a change of mind with your career. So it's best to be exposed to everything, and that they have enough cases that you can be exposed to, but then that's the best to learn. So I know my internship I did at Purdue was I rotated through everything and I learned a lot, which helped me enhance my skills throughout my career. So, but mainly it's a location of where you're going to go. Make sure it has a good caseload. Ideally, as many specialties available as possible. If that's depending on your location. Obviously, if you can't do that, at least the specialties that you seem to have some interest in, that would be the best, and that would be the best way to get connections as well.
You kind of mentioned during that, like keeping your options open because you never know where your career is going to take you. And
Yeah.
you have had a very interesting career with a lot of self-described side hustles. Can you give us just a little glimpse of some of the things you do outside of the clinic, and how does your veterinary degree really help you with all of these meandering twists and turns that you've had in your career?
So with my career, I was surprised to learn how much that I have that we can do. So one of the things I've decided just to avoid burnout is just to take part in different things that you to make sure to maximize what you can do in your career. Because I just didn't want to be like I'm going through the same cycle and going on that hamster wheel, just doing clinical work. I mean, clinical work does have a lot. Depending on the clinic, you could still be pretty fulfilled with it. It's just that I'm the person that likes to think outside the box as well. So the first thing I was interested in is, and I started, is I created my own blog. So I created a blog, and then when I created my blog, the intention was because I was trying to get involved. One of my managers had a company where they were selling pet supplies, so I created my blog and we partnered together to promote her products. But when I created a blog, I did create some articles, and some of them kind of went viral. So I was getting noticed by a lot of companies. So companies would approach me and ask me to um, write articles for them, or post their articles on there, and they would pay me for that too. So I started writing articles, and eventually some companies even approached me asked me to write articles for a fee. So I became like a freelancer, and I got paid to do that. So I was involved with that. And then I was also got involved with doing some um, editing of articles as well, where they have a reporter ask a question and they need the veterinarian to give input on, and I would just respond to that, and they would pay me for that as well. And then I also got involved in some telehealth websites when they jumped on early on, and I was doing that for some time. And even with that telehealth, that company asked me to do articles as well. So I had that on top of that. And then people would approach me to be ambassadors for companies. I would be ambassador for a back brace company. I'd be ambassador for an animal device company as well. And then I even got approached to help with design some train AI as well. So I got involved in that. And then I recently got approached for a company to do endorse some pet supplements as well, and that involved speaking in front of the camera and doing some news interviews as well. And and I decided to get another degree, a master's of public health, as I've been doing for the last 3 years, and I'm about to finish my semester this in the end of July, hopefully. So, but kind of ideally, if I was going to pursue that, the goal would be to hopefully get into medical writing, which and possibly involved in teaching as well. So, in addition to still practicing. So, but you do have that. Your career does open you up to a lot of opportunities that doesn't necessarily just show up. It's just people. Most of the stuff people approached me about, I didn't have to look for it. they just approach me, hey, do you want to do this because of my degree?
I think that might even be how I found you, because somehow your name was just out there in the universe and I just liked what you were writing. And so then you're right. Then I just approached you, please come be a mentor for us. And it's worked
Yeah.
out quite well.
Yes,
We had somebody else join us. Jan, thanks for joining us. I don't want to put you in the hot seat, but if you have any questions, we are a small group. I do have other questions that some people have submitted who aren't here, but I certainly want to give you time if you did come in with questions for our mentor tonight.
And thanks, Danny. I'm a foster, so I'm not a doctor like the rest of the people that are on this, but I I find that I can absorb as much as you guys are willing to share. So I don't have any questions, but I do enjoy the time that you put into our calendars. So I will just sit and listen, and if I do have something, I'll let you know.
Great, thanks. So we're glad you're here. Amaya, do you have anything, or do you want me to read something else from one of the submitted questions?
I'm probably just gonna hang out and listen as well.
Okay, great.
I'm good.
Okay.
I'm gonna turn my camera off though.
Yeah, go for it. And if you decide that you do want to chime in, just
All
feel free to come off mute. And it's a small group, but I don't want you to feel like if you need to go on with your night that you have to stay. You certainly don't have to. These are intended to be drop-in Ask a Mentor. Now, when we do have our meetings for our mentorship program, we're going to want you there from start to finish.
Yeah.
And if you do go, or when you go, just know we are available to you anytime, even before your cohort starts in July. So please reach out to me. You should have my contact info because you got the invitation for this. So any questions you have or any support you need, we are 100% here for you.
Okay, thank you so much.
You're welcome. All right, let me go back to the pre-submitted questions. So somebody said, how do you feel about emergency work? This sounds like somebody who's getting ready to decide where they want to be in practice. Have you done emergency work, Dwight? How do you feel about emergency practice compared to general practice?
So my exposure to emergency work was during my internship. So I'll admit I'm not a night person, so I don't. Emergency work doesn't fit for me. I like the excitement of it and doing those fast-paced cases. So I think it definitely has to be what someone's looking to do, and this has to be someone that's interested in. It's hard to compare that to GP because you either have to. Some people have different reasons why they prefer emergency versus GP, but some people don't want to have to deal with, as far as emergency, you don't have to deal with having sort of form relationships with clients because your clients, the majority of the clients you see are kind of, you're not going to see all the time. And unless unfortunately they have a very sick animal that just happens to have multiple emergencies that most of the clients you're addressing are not going to have a long term. So some people like that. Some people don't have to worry about establishing relationships. They just have to address the issue and that's it. Also, if you're a night owl, that works for you as well. Also, you'll have gain a lot of experience dealing with from urgent situations. Emergency medicine also can pay very well, but just the hours are not always that desirable. So that's why I don't function well after 12 midnight. So I do prefer GP for that reason. But again, each one has its pros and cons. So it's kind of more what someone's preference is.
So you mentioned to me when we were talking before that, in your long career, you've had a few different jobs and have become, really good at negotiating contracts and knowing what to look for when it comes to contract negotiation. What advice do you have for people who are either just starting in their careers and looking at contracts or want to change positions? What should they be mindful of? What are some of the things that you would want to ensure that people know about contracts and negotiating contracts?
So the one thing I always like to tell, or I guess warn or just advise with new grads, just one thing is when you go into this career and you start your first job, you never know what changes could happen. Sometimes a job, you can start at a job and everything looks great. But if people change existence and new leaderships, or things change in your life, like you're married or something, have an illness or something like that. I always warn about signing long contracts or signing bonuses, because as most people change their first job within the first couple of years. I think they say about 40% or so, and that might even be more. So I always tell people I don't recommend signing more than a year contract, even if you join a great company and everything looks great. Sometimes I've been in situations where I worked at a great company, I loved the company, everything was going well, but just that there was a change in leadership, and that changed the whole dynamic of the mission of the clinic. And because of that, then you want to leave, but if you're stuck in a contract, you can't leave. So I always tell people to be careful about signing long contracts. I know they can be attractive because of the high debt, but I wouldn't recommend signing more than a year, just because you can have to leave. Just reasons why you have to leave might not have anything to do with the clinic climate. It may just have to be doing with life changes, you've been married, having children, having someone that's sick as well. So, and if you're stuck because you can't move because of those reasons, that can be a challenge. So that's my recommendation for new grads. As far as negotiating, even though high salaries don't always mean a great clinic. So if you're going for a new job, I would say the grass is not always greener grass is not always greener. So just make sure you have opportunities to, at least if you can shadow a shift there, or at least interview staff members and try to see if you can pick up the culture. This culture is one of the biggest factors of if you remain at a job, even bigger than salary. So because I've worked at jobs that I want to leave because the team vibed so well together that I want to take a higher pay to leave that job, because my mental health was more than work than a salary. So make sure if you're thinking about leaving a new job, whether it's make sure it's for a reason that will enhance your career, not just enhance your pocket. It doesn't necessarily mean higher salary doesn't necessarily mean that it's a better position for you. The other thing with it, you have to kind of decide what you want. And like I mentioned, your interests are likely to change over the years. So you might think, I just want to do emergency, and I might switch to GP, or I want to do something that's super busy, or I want to do urgent care. So make sure it kind of fits your career goals, because you may want to have a pathway. You have a pathway to ownership, or a pathway to a leadership, a medical director. Make sure you have so you have to kind of decide, or you just want to to stay as an associate. So make sure you're there. Also, if you're the type of person that likes to work with others versus work alone, you have to kind of know that the clinic is set up for that too as well. So.
There were so many great points in there. I always, say a lot of what you just said, which is that the grass often only looks greener in other clinics. A lot of the problems can be similar from one to the next, and really understanding why you're leaving. And I loved your point about culture and how it is, in many cases more important than salary. And I think, there's this feeling out there because sign-on bonuses for veterinarians are so high right now because we are in such hot demand. And that is not what is most important to most veterinarians that I talk to. The statistic that you mentioned, which was 30 to 40% of people leaving their first job within the first few years, when they leave, it's because of culture. It's because of lack of mentorship. And it's not because of money. That is not, when these new veterinarians start, obviously they do have debt to pay down and they need to be compensated for what they're doing, but they want support. And looking for a place where they can be really well supported is really what they want. So I I love all of those points that you just said, Dwight.
Thank you.
There's another question that came into the chat before the meeting. And this is really timely because I'm leaving for the AVMA convention in the morning. And so it's all about networking. And so this person says, when they are having networking meetings with professionals, how do they effectively follow up after those initial meetings or interactions? So do you have advice, like when you go to a conference or you're at something where you're networking with someone and you want to follow up because you feel like they might be an important person in your network? How do you recommend follow up? I assume this is from a new grad, and I love that they asked this because I feel like, you know, for you and I, and for those of us who've been out 20 plus years, well, you didn't graduate. I'm 20 and you didn't graduate. You graduated after me, so you're not there yet. But, you know, we kind of take it for granted, you know, but the networking, I think, is a challenge for the new grads, especially when they go to a big conference and it's a little bit overwhelming. So what kind of networking tips do you have? And then especially in light of this question, for follow-up afterwards?
So networking is it's going to also depend on your personality, if you're outgoing, extroverted or introverted as well. But I think most people I find when they go to conferences are looking to network. So even if you are kind of shy, you can approach most people. Usually what works well for me is following up on, hopefully they're on LinkedIn or other social media that you can kind of follow up on them, because if I see somebody I see at a conference and I want to connect with them, I'll look to see if they're on LinkedIn. I'll send them a connection request. Most people do respond to those on LinkedIn, so that's one way. That would require you to initiate the contact after the connection. And like I said, most people are responsive. I've sent messages. I said cold messages to people asking them about questions about different things, and they've responded for things as well. Obviously email, and then you can try phone numbers, but I think those are the easiest things to do. Those tech messages like LinkedIn or social media as well. And then I would say also, as a new grad, everybody you meet and everybody you approach or even get in contact with, they can have a significant factor in your life as well. Because I've met people, I just met once. I know I have a story where I met somebody one time that was doing a relief doctor, and I talked to them and they gave me their email. Then 2 years later, they got me a job as my first leadership position. And that person has helped me get other jobs and has written references for me because we stayed in contact as well. So I think just most people are, even if some people are introvert, most people don't mind helping people, especially new grads, if you come with good advice. So I would just exchanging numbers and emails or finding them on social media. That's easy. I think social media is the easiest if you're the most introverted, because most people tend to respond to that pretty well. And then I guess aiming to have a list of certain people you're trying to get in contact with. I would say it's good to be in contact with people who are in leadership positions, who have experience. If you're interested in ownership, talking to those people. It's good to talk to a lot of owners, because owners have a lot of connections as well, so they can connect you to somebody that fits what you're looking for too. So those are usually the best people to connect with.
That's such great advice. And somebody was just telling me that veterinarians were really slow on the uptake for LinkedIn, but that there's been a lot more vets on LinkedIn lately, which I thought was really interesting. And, you know, I like that you're speaking to the introverts, because there are a lot of introverted people in the veterinary profession. And sometimes reaching out through social media or LinkedIn can be a little bit more comfortable than just walking up to somebody. But I love the story about this relief vet that you just, you didn't know where that relationship was going to go. And then 2 years later, they got you this position. It's such a really important lesson. And, the veterinary profession is filled with just the most wonderful, deeply caring people. And we love to help. I mean, obviously we're in a helping profession. We love to help our patients and our clients and also our colleagues and team members. So I love that story. That was the last of the questions that have been submitted in advance. We are probably going to wrap up a little bit early. Anything else, Dwight, that you want to share with us? Any really fun cases that you've had? Anything interesting? Anything that you, I mean, this MPH program that you're just finishing up with sounds incredible. So any final little bits that you want to share to us? The floor is totally yours.
So just final thoughts is this career can be challenging and tough, but just remember that you're always better than you think you are. Again, take any opportunities to network with your fellow veterinarians. So that's going to be the most important to help you through the tough times in this career. Don't be afraid to make changes. If you kind of feel you're not satisfied in your position, you should never feel trapped. Even if it's you don't have to have a bad experience to make a job change or change. You just have to say, hey, I want to follow my dreams. I can pursue things. I kind of think my classmates when I graduated in Cornell, I have classmates that were working full time, and then one classmate started a nonprofit organization. One classmate who was a board certified surgeon started a telehealth company. One of my classmates was on TV, so the sky's the limit in what you can do. Don't feel like you have to be stuck in one place. You have us veterinarians have talents to do multiple other things, and that's why I'm doing so many other things. I want to look at writing, medical writing, possibly pursue epidemiology if it kind of falls into place. And at the same time, just being a mentorship as well. This being a mentor is something I enjoy doing as well. So, but this, like I said, always keep positive. Keep on networking. Like I said, we all love to help. Even don't be afraid to reach out. And whoever sees the video recording, if you reach out to me and say, hey, I saw your video recording, find me on LinkedIn. Just describe I saw you on the video recording. I'll be happy to give you more information on stuff I've said if you have any further questions.
I won't be surprised if you do get reached out to. I feel so honored that I got to have such a small group and an intimate conversation with you, Dwight, because your PAC mentees in the Ready Vet Go mentorship program that you're working with right now, they get access to you, for so many hours over the course of the program. And I feel so lucky for them because you have just such like a wonderful way of communicating things and a really lovely energy and just a wealth of experience and information. So I'm so grateful to you. Thanks so much for your time. And thanks to those of you who came live and to those of you who submitted questions to be reviewed later. Thank you so much. This will be available in the Ready Vet Go community for the members, and take Dr. Dwight Alleyne up on his offer to reach out on LinkedIn and pick his brain with even more questions. Thank you guys so much. Thanks, Dwight.
Thank you. Take care, guys.
Good night.
Good night.
Bye.